So, Dr. Gold, I have a question for you. Out of the group of doctors and nurses who have been brave enough to, acknowledge they need help getting through the pandemic, what has been the worst outcome and presentation and the best outcome and presentation?
It's really interesting in that group, like in healthcare workers, a lot of people wait to get care and they're pretty bad off by the time they actually get help, in part because they were really, really trying not to have to ask for help, or there were, a lot of barriers to it, like stigma or their own cultural beliefs, or they thought they could handle it on their own. I think I'm in a unique position because I'm a medication prescriber where sometimes people come and they say, like, just give me a pill and make it go away. Like, I just want to sleep. I just want to stop being anxious. I just want to, like, can't you just give me a pill? And I wish I could do that in some capacity, but it's so much more complicated than that. So sometimes people are already pretty bad off. But if I was to think about kind of the spectrum, I mean, I think some people do notice early that it's interfering with their life. I think, worries and sort of like I'm thinking about the pandemic too much outside of work, and I'm not socializing, or I'm snapping at my kids is pretty common. Like, I don't have a lot of time with my children and I go home and I'm not nice and I don't like that. And like, what is this? And do I need to do something about it? I would say is a pretty common earlier kind of sign, as well as like, I'm not sleeping or I'm not concentrating in sort of like a short term stance. In a longer term, like harder cases, I mean, I definitely have healthcare workers who can't go in rooms that they used to see COVID patients in because they get flashbacks. I have healthcare workers that get panic attacks in the parking lot of the hospital. I think that they're, unable to work for some amount of time too. I think that is common. I've done a lot of disability, partial disability, like, short-term disability paperwork. I think less so that like I'm having a lot of people leave their jobs, but I do think that that's a really common thing for people too, which is like, this has just been too much, or I don't feel as connected to what I'm doing, and I need to not be doing this anymore. And I don't know what that looks like forever, but for right now, it's not right for me. And I think that's why we're seeing people leave. And so that's definitely an outcome I've seen too. One of the things I noticed when you were talking about like the beginning of the pandemic and how you dealt with things, like you have a lot of like reliance on meaning and purpose. Like, I can help with research, I can help extubate someone. That is a purpose I can give, and I can give myself meaning in this day. Like, is that something you know you do? And if so, like, where does that come from? And if not, do you have other coping skills that kind of like, you're using actively?
So the doing something for a sense of purpose, it's like, I think it might have been at some point learned or acquired, or I don't know if it's something I don't know if it's something I was born with, but I have always been that way, and it's something I think it's subconscious now. No, it's a good coping skill. Like, it can overextend you, because then everything has to do with a sense of purpose. Sometimes you need to recognize that, because that can lead to issues. But no, it's not on purpose. No pun intended.
Are there other things you turn to, like that that you do for coping, like when you're having a really hard day?
Oh, yes. I always say, whenever I am thinking of complaining that, I'm a young woman, I could be doing this or that, or, not be here having a good time like my friends do or whatever, I think, who am I to complain when everybody around me is going through the worst time of their life? And in what I do, this is the worst time of their life. They're having a stroke, they're bleeding in their brain, or they need some sort of, this is bad. Who am I to complain when when this is the worst time of their life? To like have that insight, and it's contagious. The complaining thing, where I'm tired, we're overworked, we're not, and it spreads, and it's toxic. I personally, I think that I do on purpose. I think that I do on purpose. Of course, I have a right to complain when but when I think that way, it turns it off, and I realize that I have no business making this a mountain out of an anthill.
I'd like to thank Dr. Forcan for giving her time and, being able to be so vulnerable. It's one of those things that's not always done in medicine and needs to be done because it changes culture in the same way where we talk about us being human. Every person who's more vulnerable will make us more human and seen as more human. So thank you so much for that.
Thank you, Dr. Gold, for taking the time to ask me all these poignant questions and listening to me ramble on and on and on about them. But it all came from the heart and the brain a little bit. But I just think the whole point of this is to make us seem, or to just for people to recognize that we are human, we're vulnerable, we make mistakes, we're flawed. That's okay, and help us accept that, because I think we need people's help as much as they think they need ours. We need that so much more sometimes, and that would make all the difference in the world. And I hope it's something that, if anything, a few maybe good things have come from this. I hope that's one of them.